Hi guys, it's Dr. Storm Shannon with StormShannon.com. In this video we're going to be going over a cool new exercise. I just learned that there's a lot of scientific research around for resetting the diaphragm and loosening it up and getting it to function properly. So the importance of that is the diaphragm is actually the roof of all of your core muscles. So if it's dysfunctional, your core is dysfunctional. And we find a lot of times in chronic pain especially, that the diaphragm is dysfunctional and keeps you from being able to get better. So the diaphragm most of the time is compensating. It will tighten up and restrict normal motion, try to create extra pressure in the abdomen. So this exercise helps reset that so that you can activate your core muscles better, improve everything. So especially if you have chronic pain, but any kind of pain really, you ought to give this a try. It's a little goofy. It involves a balloon and a ball and some stuff, but it works really well for resetting that diaphragm. So give it a try. There's a lot of little details, so keep up with me. But you're going to need, like I said, a balloon and a ball. And here we go. So you're going to lay on your back using a bench or you can use the couch, anything like that, where you can get your heels up on it. So the first part we're going to talk about is the legs. The easy part is put the ball between the knees, create some pressure. The harder part is I'm going to drive my left heel into the table and I'm going to push my right knee up a little bit. If you watch my pelvis, that pelvis comes up just a little bit. So that's how I'm doing that. I'm not bending at the knee. I'm pushing from the hip, boom, pushing that side up a little bit. The rest of it is my right arm goes straight overhead, ideally with that unobstructed, holding here. Then the balloon is going to be held by the left hand, is going to go in the mouth. I'm going to do this facing you, but when you do it, you want to do it facing up at the, up at the ceiling. So you're going to put the balloon in the mouth. What we're going to do is we're going to hold all these positions. So driving through the left heel, right knee up, right arm up. I'm going to take a deep breath in through the nose, and then as I blow out, I'm going to blow out into the balloon nice and slow for about a good 4 or 5 count. Then I'm going to take another deep breath in, 4 or 5 count in, 4 or 5 count out. The whole time I want my tongue to the roof of my mouth. So I'm going to do 3 breaths so you can kind of get an idea. And I'll still stay a little bit turned towards you, but look a little more up high. Here we go. Alright, so there's 3 breaths, which is about all you're going to get out of, the balloon before it's too full, so that it doesn't pop on you. So a couple other little details there at the end with the balloon. When you breathe out, you're breathing out through the mouth. Then when you switch to breathe back in through the nose, you're not pinching the balloon. You're using the pressure coming back from the balloon. You're equalizing that through your throat and mouth to go against that. That actually activates the diaphragm. So we don't want to pinch it. We want that diaphragm to be active. So I'm just blocking the resistance with the air in my mouth while I breathe in through my nose, and then I breathe back out through the mouth. Like I said, you only get about 3 breaths in, and then you'll have to let the air out of the balloon, reset, and go again. Try to do about 4 or 5 rounds of that to help reset that diaphragm, and then come up, move around, kind of see how you feel, see if you have decreased pain, see if it calms things down. Especially if you're really sensitive to touch, things are super sore, especially if it's like low back pain, mid back pain, even some upper back pain. This is a great exercise to try to see if it'll decrease some of that hypersensitivity that will then allow you to do other exercises to improve. So check it out, try it out. I know it's goofy. People make fun of you. It'll be all right. So give it a try and see if it helps. All right, let me know in the comments.